Here's a question worth sitting with. Not about what you eat, but about why certain ways of eating keep coming up in medical conversations about metabolic health. Low-carb diets are one of the most studied dietary approaches of the last 50 years. So what does the evidence actually say? Let's start with the basics. A low-carb diet limits foods high in carbohydrates: bread, pasta, rice, sugary drinks, sweets. In their place, the focus shifts to protein and fat: meat, fish, eggs, cheese, nuts, and non-starchy vegetables. There is no single definition of low carb. Most standard approaches land somewhere between 50 and 150 grams of carbohydrates per day. A ketogenic or keto diet goes further, under 50 grams daily. For context, national nutrition surveys suggest the average American eats somewhere between 200 and 300 grams of carbohydrates per day. When you eat fewer carbohydrates, blood sugar and insulin levels drop. That shift matters. Lower insulin can reduce water retention, which is why many people notice a noticeable drop on the scale in the first week or two. Here's the important part. Most of that early change is water, not fat tissue. Knowing that helps set realistic expectations. As carbohydrate intake drops very low, the liver begins producing molecules called ketones from stored fat. This state is called ketosis. Many believe ketosis drives the weight effects of low-carb eating, though researchers note that overall calorie intake also plays a significant role. What does the research show? Studies published in the New England Journal of Medicine have found that people following low-carb diets lost more weight in the first 3 to 6 months compared to low-fat diets. That is a real short-term advantage. But longer-term data is more nuanced. A large review in the British Medical Journal found that at the 12-month mark, many popular diets, including low-carb, produce similar outcomes. Adherence over time may matter as much as the specific plan. Beyond weight, there are meaningful effects on metabolic markers. Research published in Diabetes Care shows that reducing carbohydrates can improve blood sugar control and insulin sensitivity, particularly in people with type 2 diabetes or prediabetes. Low-carb eating has also been associated with lower triglycerides and higher HDL cholesterol, the kind associated with cardiovascular protection. Effects on LDL cholesterol are less consistent and may depend on the types of fat consumed. Low-carb diets are generally safe for most healthy adults. Some people experience temporary fatigue, headaches, or mental fog in the first week, often called the keto flu, as the body adjusts. If you are pregnant, have kidney disease, or take medications that affect blood sugar, speak with your provider before making significant dietary changes. The practical takeaway is this. Before overhauling the way you eat, spend 20 minutes with a licensed clinician reviewing your labs, your medications, and your health history. A dietary approach that supports your metabolic markers and fits your real life is worth far more than any trend. SenSlim Clinic offers video and phone visits in California and Nevada. Check senslim.com for current availability in your state.